Welcome all. Welcome to this AimExcellence EMQ question answer discussion, and it is an integrated medicine presentation. And we all know in the recent AIMS prospectus, it is said there are going to be 7 type of questions apart from the single response questions, and toughest of them is EMQ one. Alongside the reasoning and assertion, that is also a little tougher. But this is the more complicated one, and this EMQ type of questions are actually quite a lot of time being asked in the MRCP, MRCS and MRCOG examination. On the right hand side you will see the answer option list, and if you consider a case in the final MB which is presented with midline swelling in the neck, this can be your differential diagnosis. So see the first condition, Ram 28-year-old male presented with dysphagia, having a swelling in the middle of neck that moves both side by side and also on protrusion of tongue. TSH level is 2.5 million international unit per liter, FNAC finding within normal limit and no lymph node enlargement. What is your diagnosis? This is the number 1 condition. Number 2 condition, Shama is 55-year-old female presented with repeated diarrhea. On examination there is midline swelling in the neck that moves only sideways, and TSH level here 4 million international unit per liter, calcitonin is 12 picogram per milliliter, and FNAC done, presence of amyloid stroma is seen. And what is the most probable diagnosis? In this discussion we are going to only come up with the answer and not going to take salient feature, not going to talk about the salient feature or the showing you the pictures or the videos from the particular topic. We are just going to give you the answer of the particular question, and in our T&D we are going to talk about the extra salient points from that particular topic. That is going to be the answer that we are going to talk about, those extra points there only. So in the first question, what you are getting is a very important finding, that is you are saying presented with dysphagia, which can be the clinical symptom of this condition, which is there is a swelling in the middle of the neck. So it is can pressurize the esophagus out there, and that moves both side by side and also on protrusion of the tongue, that is the clincher, and TSH level is 2.5 million international unit. Here in this kind of question you have to know the normal lab values, and TSH level when the patient have not taken any medication to correct the abnormality of thyroid, that is less than 2.5 million international unit per liter. And in cases of the patients who have received, that is has to be less than 2.5 million international unit per liter. If the cases when patient have not received any medication, there it can be allowable up to 4 million international unit per liter. FNAC finding obviously is within normal limit, it is the cystic swelling and no lymph node enlargement. So what is the diagnosis? The clincher is this swelling also moves on the protrusion of the tongue, and that is among all the options that is given out here is seen in cases of thyroglossal cyst, and that is the answer of the question number 1. Now coming to question number 2 is a very characteristic finding. Shama, 55-year-old female presented with repeated diarrhea. On examination there is a midline swelling in neck that moves only sideways, and TSH 4 million international unit per liter, calcitonin 12 picogram per milliliter, FNAC done, presence of amyloid stroma is seen. What is the most probable diagnosis? From the questions it's very evident 55 is the 6th decade female presented with diarrhea. It can be the presenting symptom. On examination is a midline swelling that moves only sideways, not on the protrusion of the tongue. So it can be seen in all the conditions that have been mentioned out here. The TSH level is 4 million international unit per liter. Calcitonin is 12 picogram per milliliter. Here the normal calcitonin is less than 10. So calcitonin level is raised. FNAC done and presence of amyloid stroma is seen. So it is pointing towards the case of medullary carcinoma. Now, what is the nearest differential diagnosis? That is the main 2S syndrome. But there is no mentioning of pheochromocytoma, that is any symptom that is pointing towards the pheochromocytoma, that is not there, or parathyroid adenoma. Those things, cutaneous lichen amyloidosis, Hirschsprung disease, those things are not there in this. Those are seen in the Sippel syndrome. So the answer of this particular question is medullary carcinoma. If you like this presentation, continue to follow us in the Facebook, Twitter and YouTube. If you have any queries regarding this particular presentation, please write to us in our Facebook pages message boxes. And remember one thing, the TSH level, medullary carcinoma is TSH independent. So it is not going to make a lot of difference. But calcitonin level and CEL level are going to be raised. All the extra points regarding all the condition, all the differential diagnosis, we are going to talk about that in later in right time, place and person. As I say, is right TPP. We'll let you know where we are going to show you the TND. Thanks for listening to us. Thanks for support. Thanks for all your support. And if you like our presentation, be with us. Thank you.